0 to work with the operator to get your question queued or concern if you're thanks so much.
Then we have Dean first, and then we go through and then Kat.
Good morning, I'm Drew Carney. Oregon Governor Kate Brown is speaking now about her decision to hit the pause button on the state's reopening. No counties will be able to move to the next phase of reopening for at least a week. So let's listen in to Kate Brown.
We were not able to secure services this morning, but we will provide translation online. Lo siento. I am here with Pat Allen, Director of the Oregon Health Authority, and Dr. Dean Seidlinger, our state epidemiologist. And I'm going to keep my remarks brief this morning. When we began reopening nearly a month ago, I was clear that COVID-19 cases, our counts would rise. Unfortunately, we are now seeing that happen in several parts of the state in both rural and urban Oregon. As I've said before, reopening comes with real risk, and that's why we are carefully monitoring the ability of our public health system to respond to COVID-19 cases without becoming overwhelmed. The noticeable increase in COVID-19 infections in Oregon over the past week is certainly cause for concern. In order to slow the transmission of the virus, I am putting all pending county reopening applications on hold for 7 days. This is essentially a statewide yellow light. This 1-week pause will give our public health experts time to assess what factors are driving the spread of the virus and determine if we need to adjust our approach to reopening. I will continue to work with doctors and public health experts to assess whether to lift the pause, extend the pause, or make other adjustments. As a reminder, we currently have 29 counties in Phase 2. 3 counties, Clackamas, Lincoln, and Washington, are in Phase 1 and have not yet applied for Phase 2. 3 counties, Hood River, Marion, and Polk, are in Phase 1 and have applied for Phase 2. These applications are being put on hold for 1 week. And Multnomah County is still in baseline status. County leaders have applied for Phase 1. I have put their application on hold for 1 week as well. If you want to get the full details on the reopening status in your community, please go online to www.coronavirus.oregon.gov. I know how frustrating it is to move slowly. We all wish this reopening could be happening faster. Oregonians should know that county leaders are working extraordinarily hard to make reopening possible. My job, however, is to make tough decisions, even when they are unpopular. And when it comes to the health and safety of Oregonians, the buck stops here. To all of the business owners who had planned to reopen this weekend, I want to acknowledge how difficult this is for all of you. Many of you have invested significant time and resources into reopening safely, ordering supplies, hiring staff, and just keeping your lights on. However, as Dr. Fauci has said, we don't make the timeline, the virus makes the timeline. Now, no matter what county you live in, today's decision to pause as a state is a clear reminder that we need to double down on the simple but effective precautions each of us should take to reduce the spread of the disease. Number 1, wear a face covering. Number 2, keep physical distance of 6 feet. Number 3, avoid large gatherings. Number 4, keep it local. If you want to get outside, please stay close to home. Number 5, wash your hands, cover your cough, and please, please, please stay home when you're sick. Now, I'm delighted to turn it over to Pat Allen, the Director of the Oregon Health Authority. Director Allen.
Thank you, Governor. I want to echo Governor Brown's caution and state clearly that the health measurements we're using to monitor COVID-19 in Oregon support her decision. We're seeing enough signs of concern that tell us we need to slow down. Here are some of the warning signs we're watching. New cases are rising. Yesterday, the Oregon Health Authority reported 178 new cases of COVID-19, our highest total ever. Newly reported COVID-19 cases increased by 75% during the week ended June 7th. A total 620 new cases of COVID-19 infection. The prior week, cases rose 18%. Testing has increased, but so has the percentage of positive results. The number of COVID tests reported, 18,271, increased compared to the previous week, which is good news, but the percent positive rose from 1.9 to 3%. Oregon's positive percentage rate remains well below the nation's positive test rate. However, we want to see the positive percentage of cases stay flat or drop, not increase by half. Hospitalizations have increased. New hospitalizations were on a long downtrend, but the 7-day rolling average rose in the past week from 4 to 6 cases of severe COVID-19 illness per day. Because the number of severe coronavirus cases does not depend on the amount of testing we're doing, new hospitalizations are a telling measure of how well we're doing. Yet, because they're a lagging indicator, they tell us about infections that occurred many days ago, not what's happening right now. That's why we will continue to watch hospitalizations closely. There are some positive signs. Emergency department visits at hospitals for COVID-like illness are below 1% and have remained low and level for several weeks. Local health officials are staying on top of contact tracing. Across the state, 95% of contacts are being reached by contact tracers within 24 hours. Most cases of coronavirus are being linked to a known source. Only 22% of cases can't be tracked to a prior exposure, which means local health investigators can identify people who might be contagious and isolate them, and there are fewer sporadic cases in the community. What's driving the increases that we're seeing? A few things. Large workplace outbreaks. We've reported a major outbreak in the Pacific Seafoods facilities in Lincoln County this week, along with other workplace outbreaks around the state recently. These outbreaks have affected our overall totals and our daily numbers. We are performing increased testing. More testing is turning up more people who are infected, which is what we would expect. Since COVID-19 linked emergency department visits remain stable, we believe the increased tests are finding more people who are asymptomatic or pre-symptomatic, but don't have serious illness. That's a good sign, especially for our hospital systems. Gatherings. There have been large gatherings across the state, some involving protests, some not. It's still not clear whether the most recent large demonstrations in Portland or other communities around the state have resulted in the spread of coronavirus, but we will have more evidence in coming days as local health officials contact people with recently diagnosed cases. Reopening. We said all along that reopening comes with risks. Our models told us that we should expect to see more cases as we began to resume normal activities. What's happened this week has confirmed the accuracy of those predictions. For these reasons, we're slowing down Oregon's reopening. But today's pause is a reminder, not a rollback. Ultimately, my biggest fear is that people treat phase 1 or phase 2 like returning to things the way they were before the pandemic began. That's not what needs to happen. We can do normal things, but not the way we did them before. Keep physically separated. Wear a mask when you're close to other people. Don't go to work when you're sick. Wash your hands. These aren't just a good idea, they're what we have to do to be able to remain open. And very important, answer the call. If you hear from a contact tracer, answer her questions and stay home and isolate yourself if you've been exposed to COVID-19. Now let me turn it over to Dr. Seidlinger, our state health officer, who can talk about some of the issues we're seeing in the counties we've paused.
Thank you, Governor Brown and Director Allen. COVID-19 has affected people throughout Oregon, with some communities especially hard hit. During this pause, I hope all Oregonians will take steps to protect themselves, their families, and communities. Here are some of the warning signs we saw in the counties that asked to move forward. In Multnomah County, we've seen an increase in residents admitted to the hospital over the last 2 weeks. The positive test percentage is going up in the face of increased testing. And over 40% of the cases identified last week were not traced to a source. Hood River County has also seen an increase in new cases and is managing 3 simultaneous workplace outbreaks. Marion County has seen almost 40% increase in cases over the last week, and their hospital admissions for the residents from the county are also increasing. Polk County, again, has seen an increase in cases over the last week and is managing a worksite outbreak. We've also looked at our latest modeling results, which show some notes of caution. Our latest modeling indicates that transmission rates, after over a month of decline, appear to be increasing since we reopened. Right now, we estimate that for every person with COVID-19, they cause at least one additional person to be sick. But we don't know how quickly the virus is spreading. So we projected 3 scenarios this week. In the most optimistic scenario, we predicted a 10 percentage point increase in transmission that began in the middle of May, which is what the data showed us. If this trend were to continue over the next month, the number of new infections per day is projected to remain relatively stable. In a less optimistic scenario, we predict a 15 percentage point increase in transmission after the middle of May. If that trend continues over the next month, the number of new infections per day is projected to slowly increase to as many as 270 per day by July 3rd. The most pessimistic scenario includes increased transmission after reopening, which increased again over Memorial Day weekend. Again, this came from the data, and this would pose the risk of hundreds and hundreds of more cases each and every day. We don't see evidence that that's emerging yet, but we want to prevent that. So it's too soon to say which scenario is likely to play out. Each one remains a possibility, but we can work together to suppress the virus and keep infection rates flat or contained at a manageable rate. And if we all continue to be careful to reduce our own risks and the risks we pose to others, we can accomplish great things. But if we don't do those things, we risk a rapid rise in cases that will not only jeopardize the progress we've made, but could fill our hospitals and risk that Oregonians cannot access the quality care we all deserve. As Director Allen said, COVID-19 isn't going away anytime soon. We all need to stay vigilant and do our part to keep COVID-19 contained. And to quote one of my contemporary heroes, Dr. Bonnie Henry, the Provincial Health Officer in British Columbia, now is the time for everyone to be kind, to be calm, and to be safe.
Thank you, Dr. Seidlinger. I think we're ready to take questions at this point.
Great. Thanks, everyone. First up, we've got Mila Mimica with DPW. Go ahead, Mila.
Hi, Governor. You kind of answered my question with the businesses reopening in Multnomah County, but what do you say to the citizens and the workers and the business owners who expected to reopen tomorrow, I apologize, today, and were kind of caught off guard by your late announcement last night?
I'm sorry, we're all frustrated. As I said, and Dr. Fauci said, the virus makes the timelines. We don't make the timelines. And we are all in this together. And I want to encourage people to continue to take precautions, to be kind toward your fellow Oregonians, to be considerate toward your neighbors and your community, and to continue to be safe in the world out there. This is going to take time, and I appreciate everyone being patient through all of this. As a kid growing up, I had the opportunity to ice skate on local ponds in Minnesota, and we were always very cautious when we first went out into the ice. We'd put our skates on and take a step forward, and if the ice felt safe, if we didn't hear cracking, we would take another step. And that's kind of where we're at right now. We're proceeding extremely cautiously. I would say we are pausing and waiting to see if the ice is strong enough to support all of us.
Thanks, Mila. Next up, we have Mira from OTV. We might have lost Mira. Let's see. Up next, we've got Shane with the Oregonian. Go ahead, Shane.
Hi there. Question for Director Allen. I know that you mentioned that it might be a couple of days before we get a better sense of whether or not some of the large gatherings and protests that have taken place have caused or created an increase in recent COVID transmissions. But I want to ask, as of this morning, June 12th, have state health officials seen any cases at all linked to protests or demonstrations over the last couple of weeks?
Yeah, I would actually turn that to Dr. Seidler, who's more familiar with the case information.
We are working with our local public health officials to ask information about attendance at large gatherings such as the demonstrations in Portland and other cities. We know that some people may be reluctant to share that information with public health investigators, but to date we don't have any reports of people who've tested positive who've attended one of these demonstrations or protests.
I would just add a couple of things. Number one, I appreciate Multnomah County opening up a testing site for citizens that have protested that may be showing symptoms of COVID-19. And secondly, we are seeing outbreaks, and one of the reasons I felt strongly about taking this pause is that we are seeing outbreaks in communities all around the state. Lincoln County to Union County, to Wallowa County, in fact. And so this is impacting all of us. Each one of our actions make a difference, and I want to encourage Oregonians to continue to use face coverings, whether they're going to the grocery store or whether they're out taking action.
Thanks, Shane. We lost Mira, but she emailed in her question. Mira Powell from OPB asks, what is the specific guidance for travel in the state? Are people in Multnomah County expected to stay in Multnomah County, or is it somewhat expected that people will be traveling to nearby counties that are further into the reopening process?
Look, we're asking Oregonians to be considerate of your fellow Oregonians and to keep your recreational activities local. I know this is really hard. I know we all enjoy going to the beach. I actually enjoy going to the beach any time of year. I enjoy hiking in the gorge. I want to continue to encourage Oregonians to keep their recreational activities local and to check state parks websites for park locations that are open.
Thanks, Mira. Next up, we've got Gary Warner from EO Media. Go ahead, Gary.
Yes, good morning, Governor. I have a policy question and then a follow-up, which is that the things you're announcing today, do they have any impact on the counties that are already in phase 2? And second, Dr. Seidler talked about some of the problems in some of the counties that are in phase 1 or are on baseline. Are you seeing problems in specific counties that are in phase 2 that concern you? Thank you.
So, Gary, the pause is every county is where they are at right now. So for counties in phase 2, they're staying in phase 2. For counties in phase 1, they're staying in phase 1. And for Multnomah County that's in baseline, it's staying in baseline. So everybody is just staying in the current phase.
I'll take the second part of that. I think what we're seeing is that this disease is impacting communities across Oregon, from our urban areas to the rural areas, the coast to the mountains, and in between. We're seeing the spread connected to different things. We've reported on several large workplace outbreaks. We continue to support long-term care facilities and respond to outbreaks there for some of our most vulnerable populations. And we're also seeing spread as people come together in various aspects, come together for social gatherings, parties, barbecues, and otherwise get back together with their friends and family, and we do see spread in those areas, and that's why we continue to urge people to take cautions. Stay physically distanced. Yes, you can get together in small groups locally. Wear a face covering. Take precautions. Don't attend if you're sick. Wash your hands often. And together, by doing these things, we can get through this without seeing significant increases in cases, because we all have a role.
Thanks, Gary. Next up, we have a question from Andrew Selsky with the AP. Andrew asks, are you prepared to shut down any county that is in phase 1 or phase 2 of reopening if circumstances require?
Thanks, Andrew, for the question about whether I'm prepared to shut down any county, regardless of what phase they're in. At this point in time, we're issuing a yellow light, asking everyone to be extra careful. We're holding where we're at and hoping to not step forward. But as I've said a zillion times, the virus makes the timelines. We don't make the timelines. And we are just asking everybody again, we are truly all in this together. And it's so important that we consider our family members, our neighbors, our friends, and our communities every time we take a step. And so I want to encourage Oregonians to continue to be kind, to continue to wear your face coverings, and of course, to continue to be smart.
Thanks, Andrew. Next up, we have Rosemary Reynolds with KXL Radio. Go ahead, Rosemary.
What benchmark did Multnomah County not meet for reopening? So I'm saying, what specific criteria did the county fail? And the question's for Dr. Seidlinger.
Thanks, Rosemary. We're going to give it to Dr. Seidlinger.
Thank you. Similar to other counties when they applied to move into phase one, Multnomah County was seeing an increase in hospitalizations over the last 2 weeks. This is concerning because we know that indicates transmission that's happened in the past, and these people are now sick enough and seeking care in the hospital. Also, as we've increased testing, unfortunately, we've also seen the positive test percentage in Multnomah going up, and over 40% of their cases were not traced to a source. So taking those things together, especially that hospital number that we've said is a criteria for entering into phase one, those are the criteria that Multnomah County didn't meet this week to move forward.
And Rosemary, I want to reassure Oregonians that we are going to continue to put the health and safety of Oregonians at the forefront of our decision making. Dr. Seidlinger mentioned the factors that were particularly concerning. We are going to continue to use science and data in making those decisions. I want to say thank you to the physicians, the medical professionals at the Oregon Health Authority, including Dr. Seidlinger, that are helping inform my decision making, as well as the medical advisory panel that is assisting in these decisions. These are not easy decisions. These are really hard. And we spent the day contemplating the data, talking with local elected officials, talking to epidemiologists. This was a really difficult decision to make.
Thanks, Rosemary. Next up, we've got Rich Reed from the LA Times. Go ahead, Rich.
Oh, hi, Governor. Rich here in Seattle, where also, as you're probably aware, there's a increase in Washington State. And I know that Oregon and Washington, I think, were in a coalition of states for a while. I'm wondering what the status of that is and to what extent you're consulting with other states, and also what help and guidance, if any, you're getting from the federal government, whether the White House or the CDC.
Thank you. I would say we are continuing to rely on the CDC guidance in our decision making, and that's been extremely helpful. In terms of our coalition, our Western PAC, our chiefs of staff continue to speak regularly, and I know that our public health directors are communicating regularly. I think we're really focused on sharing and replicating best practices, learning from one another. As you know, there's absolutely no playbook here, and it's been really helpful to have our regional partners share in this work. At the outset of this work, we focused on creating similar phases and similar prerequisites for opening. I know that given the regional nature of the work we're doing, that we may have taken little different paths, but it's been really helpful for me as governor and for my team to be able to collaborate and coordinate with other states in the Western region.
Hey there, I've got a few questions. The first one is, Governor Brown, as you know, businesses in Multnomah County have been preparing for weeks to get to this point to reopen, and many were set on hopefully opening this morning and been working for days to get everything ready. And then the announcement didn't come down until after 7 o'clock last night, just hours before they were expecting to reopen. What took so long in announcing that decision?
Look, I know this is extremely frustrating. I know we are all really disappointed. I personally miss going to my favorite restaurants and my favorite boutiques, and I know other Oregonians do as well. These small businesses are truly the heart and soul of Oregon's economy, and frankly, the heart and soul of our culture. And I am hoping that we can get them up and running in Multnomah County as quickly as possible. However, I have to put the safety and health of Oregonians first. And my major concern is that we are seeing a number of cases in Multnomah County that cannot be traced to a source, and that should be very concerning for all of us. My team and I spent the day yesterday talking with experts, epidemiologists, and physicians, as well as talking with local public health officials. This was not an easy decision to make, and this was really, really tough. And again, I'm just having to put the safety and health of Oregonians at the forefront of our decision making.
Okay, I had another question similar to that. When we look at the state and the reopening status of the different counties, Multnomah County is the only county still in this baseline phase. We know specifically in the Tri-County area that a lot of people travel back and forth between the counties, between Washington and Clackamas and Multnomah. Many people work in one and live in the other. Does it make sense to keep Multnomah County in this baseline phase when the counties surrounding it are in at least phase one?
So that's a very legitimate question, and that was one of the issues I wrestled with, was the fact that people travel. They don't stop at the Multnomah County line and decide not to go to Clackamas County. That as we travel for work or to go get our hair cut or to go to a restaurant, we don't look at where the county line ends and begins in terms of jurisdiction. What I would say is this. My reason, my purpose in issuing a yellow light, and I see yellow lights as a caution. I think most of us have been trained, not all of us, but most of us have been trained when we see a yellow light to slow down. And that's what I am asking Oregonians to do across the state. There were a number of concerning factors in Multnomah County, but as I said earlier, there have been outbreaks in communities from Wallowa County to Lincoln County, and that's why I'm saying all of our actions matter. I'm encouraging, I'm cajoling, I'm asking Oregonians to wear their face coverings when they go out in public. I am asking and encouraging Oregonians to continue really solid hand washing and hand sanitation practices, to cover your mouth when you cough or sneeze, and to maintain physical distancing. We are truly all in this together, and every single one of our actions matter.
Thanks, Genevieve. Next up, we've got Ken Shipman from the Newport News Times. Go ahead, Ken.
Hi, can you hear me okay?
Yep.
Yes.
Okay, it's Ken Lip. So my question involves, it's just a local matter, but the recent outbreak here has our local health department faced with a pretty daunting task of tracking contact tracing and case investigations for more than 100 people pretty much at once. So I'd like to know what the health authority and the state is doing to assist our local health department and others in rural areas that are facing outbreaks. And kind of further to that, if the health authority could clarify why it was that this outbreak was originally classified or characterized as a low risk.
Sure, I'll go ahead and take that question. This is a very large outbreak, and while Lincoln County was very well prepared, to deal with outbreaks. This is the kind of a size in a community of this size that would be overwhelming and under any circumstances. They have made use of mutual aid assistance from a variety of counties, tribes, and other organizations to increase the amount of contact tracing and case investigation they can do. We're providing them a variety of resources, including testing supplies, additional staff. I've got a leadership team on the ground there today working with local government emergency management and public health to better understand their needs and work quickly to meet those needs. I think the low risk characterization is a good question. I think you know about an outbreak as it starts, and you say some things about it, and then you learn more. And that's maybe not the same statement that we would make today based on what we know about the nature of that outbreak as we sit here today on Friday versus last Saturday or Sunday.
So I will just also add, I've had an opportunity to talk with local elected officials there. I know that their local public health is working very hard to address this outbreak, and appreciate the partnership and the resources that the state can bring. I just want to give Oregonians a sense of sort of the minute detail that we need to work in terms of addressing the needs of, for example, some of the workers in that particular community. So in addition to Spanish-speaking workers, we in addition have folks from Guatemala, and they speak an indigenous language, and there are 2 dialects of that language. And so we need to have both contact tracers and case investigators that are, I would say, multilingual to address the needs of the community there. And the community is working very hard. The local public health system is working very hard, and they are certainly going to continue to need the state's assistance, and we are stepping up to provide that. In terms of Oregonians' ability to attend a church or mosque or synagogue, I hear you. I know this is extremely frustrating. I know for many of us, our spirituality, our faith is what sustains us. It's what creates community, and it gives many of us a sense of hope. I want to encourage you to practice your faith carefully and cautiously. There are faith communities around the state that are able to open, but for right now in Multnomah County, we're severely limiting the numbers because we want people to stay safe and we want people to stay healthy.
Thanks, Jenny. We're on an abbreviated timeline today, so sorry folks if we weren't able to get to you. If you're in the queue, please feel free to reach out to our office with more questions. Thanks.
Thank you. Thanks, everybody. Thank you for being here.
We've been listening to Governor Kate Brown this morning talking about the state's decision to essentially hit the pause button on reopening. So again, no county can enter a new phase of reopening for at least the next 7 days. And obviously for Multnomah County, that means they remain the only county in the state that has not yet entered phase 1. We will continue to cover this story throughout the day. We have more information available right now on our website. You can check that out at kgw.com. Now back to our regular programming.